I'm Dr. David Nonweiler. I'm an orthopedic surgeon with Central States Orthopedic Specialists, and we're here today to talk about an exciting new advance in total joint replacements, something that we're doing here at Central States Orthopedic Specialists. It's kind of the latest in technology, and I think it's a tremendous advance in the way in which we do knee replacements. And so I'm going to show you just a little bit about how that's done and why it's better than a standard knee replacement. A model of the thigh bone. So you're looking straight on at the thigh bone here. So this is the inside part of the knee, this is the outside, this is the top, and this is the bottom. So in a knee replacement, you have to cut this portion of you have to cut this bone in order for the knee replacement to fit on there correctly. In a standard knee replacement, you would drill a hole right here and run a rod up this bone to check the alignment or to get the appropriate alignment. With the new system, it's called a signature system. Signature because it's individualized for each patient. So with the signature system, the patient has an MRI scan made, and then from that MRI scan, the company makes a plastic mold which is going to direct our cuts based upon this mold. So we use a computer program, get everything set just exactly the way we want it to be, and then this mold comes. This mold fits perfectly on the bone. So when you put it on the bone, it fits just perfectly. There are no gaps, no spaces. And this sets the cuts that will then be made for the knee replacement. So after this has been placed, we put pins in to hold this mold in place. Put pins in there, and pins up here in the top. These holes are then marked, because we'll use those later. And this piece is removed. Normally the pins stay in, but I don't have a nice way to get the pins in. So the pins remain there, and then this is a cutting jig which fits on the bone. And a saw blade comes right through here to make the cut of the bone. So the saw blade comes right through this slot in the top of this to make the cut of the bone. And everything has been set by this model that we had made preoperatively with an MRI scan. And that sets the slope, the direction, the degree of cut. Everything's set automatically as soon as you put this on. And this is once again developed by a computer which has made a 3D images. The advantages of this procedure is it's faster than a standard knee replacement. There's less blood loss because you're not drilling this hole in the center of the bone. And then the alignment of the knee is better because it's been done through a computer before the surgery. And then if there are any special circumstances where there's a lot of bone loss or any unusual situations, we can plan for those preoperatively because the computer will show us that problem and how best to handle that problem in surgery. To date, we've done about 55 of these procedures here at Central States Orthopedic Specialists. I've done quite a few, and then two of my partners, Dr. Kyle Robertson and Dr. Brian Hawkins, have also done these procedures.